Hey everyone, we're back. It's the Marketing Share. I'm Alec and I'm here with co-host Barb.
Hey, Alec.
Hey, we have a guest returning with us today to talk to us again. I love it
I,
when this happens.
I know that's the boomerang guest. They're back again, right? So, I love Noah. Okay, so today's guest is Noah Goldfarb. He's the director of client services at Fire and Spark. It's one of the leading digital health SEO agencies. And he leads organic strategy, growth strategy for some of these innovative healthcare brands like Bicycle Health, Alara, Moki Health. I think you might have remembered that from last time we had him on.
Mhm.
And then also, he runs a digital health growth mastermind, which is a community of digital health growth marketing leaders who share insights via online communities. So he's like a wealth of knowledge on SEO and now LLMs and AI and how that's affecting search. So,
Yeah, and we wanted him back on because this is it continues to be an area where there's just a lot of questions. I know we've talked about this before with a lot of other guests, and so we're
yeah.
talking about it again. But I think the reason is because it's this is a changing market. There's still questions. The weird thing is that it's changing, but then as we'll hear, I think he's going to talk about, yes, it's changing, but then some of the tactics that we use aren't changing a whole lot. And in fact, maybe are going back to some of the things we've known that are tried and true. So it's a weird dichotomy going on right now. But
Well, I think also on this one for sure, right? Traffic search is down. So you've got to help others in your organization. If that's been a major metric for you, which I'm sure it has been for many marketers, right?
yeah,
When search is down, to your site so much, how do you kind of pathway that with your organization? And Noah's going to give us some good insight on how, while traffic might be down, other areas might not be down, and it may just be a way of targeting more valuable traffic than we had in the past. So it's sort of reframing that needs to be done.
yeah. Okay, well, let's go talk to Noah.
Cool. Hey, Alec, how's it going?
Hey, Barb, I'm good. Glad
I'm
to be in
good.
studio here with Noah.
I know. We're with our friend Noah Goldfarb from Fire and Spark. So let's jump in. Noah, you have some new data that you've just come out with recently that we want to dig into. And I think our listeners or viewers will really be interested in. So let's start. There's two of them actually, but let's start with the Telehealth 20, because I think that one's an important one. Now, you analyzed over 400 telehealth brands SEO strategy. What was the timing of this project and what were the big ahas that came out of this as it relates to SEO?
Yeah, so we were looking primarily at the data we have access to, which is going to be public facing data from tools like Ahrefs or SEMrush. So tools that a lot of people use. We were able to do it at a pretty large scale, though. It took a lot of time from our team, but we were looking at traffic trends year over year. All in all, this took us about 2 months to put together to look at the data, analyze it, and tell the story of it all. And we did this back over the summer. So we're actually hoping to publish an updated version probably sometime in the next few months. So, I mean, biggest surprises, one would be there were a lot of large brands, a lot of telehealth brands, digital health brands that are even approaching like household name status that don't really seem to be investing all that much in SEO. Some of that's just due to business model. Like sometimes it just isn't the biggest lever you can pull, but it's still interesting to see one of these channels that as an SEO professional, I see as being very important at least, but it's still used kind of tactically by certain brands. And I would argue for some of the brands we looked at, I would say probably underinvested in relative to some other channels, such as paid.
Are we talking like big brands like Teledoc and some of these or?
Yeah, so we focus primarily, I don't know if Teledoc made it into our data set. We were focusing on D2C providers for the most part. So telehealth providers. So big brands in there, that would be like Row, Hims, I believe was in there, MIDI, and some others like that. So pretty large brands. A lot of them are doing quite well. MIDI made our top 5. They're doing quite well. But a lot of them also, just not investing a lot on the SEO side of things. What we saw, though, even for the brands that were doing well, which was also surprising to us, was really the focus on informational content and like trying to show up, essentially the blog, trying to show up for informational terms, question terms and things like that. all of which is good and well. But the reason it was so surprising to us is even back in June, people were already talking about the impacts of AI search, which I know we're going to get into a lot later. And obviously, one of the big impacts of AI search is those questions that people used to need to go to a website to get answered. Now they go to just the Google page itself or to ChatGPT or whatever their LLM of choice is. So it was surprising to see essentially how exposed a lot of these brands were who were doing well, and their traffic appears to be going up from the data we have access to, but still exposed to that kind of downside risk of AI search. They very much had their eggs in a singular basket, which was their blog for the most part.
So let me see if I get this right. So the aha was some big brands were not crafting content that would be LLM friendly content. Is that what I'm hearing? Or reliance on blogs or?
Yeah. So essentially what it is the brands that are winning, and by winning, what we're looking at, the data we're looking at is traffic. So it makes sense that the brands that are winning the most, gaining the most traffic year over year, they are writing a lot of blog content. And the reason that makes sense is more people are searching questions, trying to get questions answered, than people are actually searching to convert. Most of the time you search something in Google, you're not making a purchase or signing up for something. So that helps traffic really go up. And that's great. And there's nothing wrong with that.
Yeah.
The issue is more and more for that traffic, you're competing with AI tools and LLMs. So click-through rates are going down. Traffic on Google isn't really going down, but in the long term, you could see that happening as people go straight to the ChatGPT button on their Microsoft device or whatever it might be and skip Google altogether. But the surprising part of it is, one, they're really going all in on that direction, even though there's, I think, most people in the marketing field would agree, some pretty established risk there. But then the other surprising thing is just how underinvested they were in the rest of their site, like the money pages on their site, so to speak. And that's usually going to be landing pages or even their homepage lacking, the simple part of it for SEO being like keyword targeting. Like, do you have the thing that you treat? Are those words even on your homepage or on your primary landing page? If somebody lands on your homepage, and they figure out what the heck it is you even do and why they should choose you over the other brand they heard about. A lot of that stuff was missing. And I would have assumed for some of the larger brands in the space that would be table stakes, stuff they sorted out years ago, and often it wasn't.
Do you think that's a sign that they know something we don't? Or is it more you view it as like, hey, this is an opportunity area for them to improve?
Yeah, definitely opportunity.
Okay.
So the way we formatted this, we looked at all the data. We looked in the guide, starting out at like the industry level, what niches what verticals within digital health, telehealth are doing well. And then we took the top 5 winners, top 5 traffic growers year over year. And we looked at how they did it. And for each and every one, we also noted the opportunities for them. So I would definitely consider it an opportunity. The way these brands got here, if I had to guess, and this is based off the conversations I have with people that come to us and our clients, like why they come to our agency, is traffic is very easy to chase. And it's much easier to pursue and optimize for traffic than it is to pursue and optimize for conversions. And I mean that in a few ways. One, data. You can go into a tool like Ahrefs and SEMrush, and you can see how much search volume there is for a particular keyword on a monthly basis. An estimate, but it tends to be pretty accurate. You can't see how many people are likely to convert for your brand from that particular search term. And then the other thing is there's just so much more search volume and there's so many more keywords that are informational, low intent, that it is often the thing that an SEO, whether it's internal or an agency, is driving towards, because they want to measure their success, and their boss or whoever's, their boss or the company that's hiring them, they want to measure success. And it is much, much easier from just like a data management perspective, especially in the healthcare space, to measure success when it comes to traffic growth and the number of keywords you're showing up for rather than the actual business impact, because it's so diffuse. With SEO, someone comes to your site, on day 1, and it might be day 80 when they actually come back and convert. And it might not even be on an organic session that time around. Did that answer you? That was a long way.
No. And actually, this might be a good lead into my next question, which is, so as an SEO expert, what do you see some of the better companies doing around SEO that the rest of the people aren't doing, right? I'm kind of looking for, what are the hidden tactics or hidden strategies that maybe aren't as well understood?
Before I get exactly to the hidden piece of it, the stuff that was also surprising from the winners was just how much of it is really fundamentals. Like I think in SEO and across marketing, people look for the hacks and the secrets and the tricks.
Yeah.
And a lot of it was they had really good writers with letters after their name often, or at least that's who it was accredited to.
Yeah.
They understood and spoke to the intent behind the search. And then the actual experience of using the site was good.
Yeah.
It was like a nice UX.
Yep.
And it was clear where the conversion actions are and all of that. So that helps. And that was surprising just how consistent that was. There was one company in the top 5, it might have even been number 1, where they were going for a definitely much more of a high quantity over quality approach to their content. And it worked for them, but elsewhere in our list, we didn't see that. To your question, what I've seen that still works, but it's a bit more of it takes more sophistication to pull it off, and also a little bit more of risk tolerance, is some of the more programmatic approaches to keyword targeting. So I've spoken to some brands and we've worked with some brands who, whether it's with local keywords, which even in telehealth have a lot of value to them, somebody searching this kind of treatment near me. Some people don't even consider telehealth as an option. They're not familiar with it, but they're persuadable. You can build those pages at scale. You can, set up a database and use apps in the back end of your site or do it custom and launch 1,000 of those at once. Not everybody wants to do that. It's not what Google would ask you to do, but it can certainly work. And then other companies out there that we've talked to have a similar approach. And just throwing an example out there that's relevant to this particular brand I'm thinking of is like for prescription medicines, where they have they use a database and a programmatic approach to building thousands of pages with information about prescription medicine. And it's kind of surprising to me that stuff still works in 2025. And, hardcore white hat SEO people would say it doesn't work or it shouldn't. From my experience and the data we see, it is actually working better than I would have expected.
I've heard that before. We're going back to, in some ways, going back to the basics and the fundamentals. Get those down right. Yeah.
Yeah, but how surprising, right? The near me is, a local search win for telehealth, something that you don't have to be near.
Yeah.
It's kind of wild, huh?
Yeah, it's interesting. That's like a great example of, speaking to non-solution aware searchers, or at least searchers who aren't looking for your solution, but are persuadable.
Yeah.
And I think in the, it applies a lot in the digital health or telehealth market. But for any like cutting edge brand or industry, like that is one of the key challenges of SEO is people might not be searching for what you do, but they might be very open to what you do. So how do you get in front of them and then make that pivot, address the barriers to conversion?
Yeah, you have to search on the outcome that they're looking for and then show them how that ties back to a solution they didn't think of.
Yeah. So the near me is the path to get there. Interesting. Very interesting. Okay. So a lot of especially B2C telehealth companies are really reliant on paid search, right? But what are some of these companies leaving on the table with regard to organic demand, do you think?
I mean, again, it's kind of what we were just talking about. It's failing to pursue those middle and lower funnel search terms. Prioritizing traffic over conversion. And then the other thing I'll say is even when you're prioritizing traffic, which on the whole means blog and informational content versus some more conversion oriented, landing pages or lower funnel content. When your measure of success is traffic, you are missing the entire rest of the journey. Like it doesn't actually respect the patient journey. It kind of has this feeling of, well, all we need to do is get them on the site, and then that's the end of our job. And if they convert, they're going to convert on their own. And that's not really the way it works. Like they have follow-up questions. They have questions about your specific brand and how it works and how you compare to alternatives. Like there's all sorts of stuff going through their mind, especially in healthcare. And there's one example that jumps out that the guide where they wrote a piece about a prescription medicine, and this is one of the top sites, so they're doing well when it comes to traffic, but they wrote a piece about a particular prescription medicine for a condition that they treat. The thing is, if I understand their business right, they don't prescribe. So their article was all about saying, here's why you shouldn't take this medicine. Here's why it's not the right thing. Nowhere in it does it say, and actually, here are some alternatives that you should pursue. And by the way, we also offer those. And here's the questions you're likely to have and some answers about that. It doesn't do that pivot. And it was very successful for ranking. And that's fantastic. And maybe the people will get the rest of the way there to a conversion on their own. But I think that kind of thing is just a across the board missed opportunity. And it's hard because it requires like concerted effort for each and every piece that you publish, thinking about what is this person looking for, and are we like bridging the gap to help them find that thing. And in that case, it would be proposing alternatives that this brand actually does provide.
Yeah, we used to call that teaching to the test, right?
Yeah.
It's kind of like, don't leave out that's the punchline of the whole thing, right? I mean, that's kind of interesting that someone would leave that off. I guess it's a great follow-up opportunity for them, right?
Yeah, exactly. And it's like, you might view it as a phased approach. Like if you're all about bringing in traffic and brand awareness, phase one, like that's hard. Don't get me wrong. That's hard in and of itself. But when you're looking back at, additional opportunities or, looking back at your content library and trying to maximize it, I think that question should be asked about every page on your website is for the terms it's ranking for, what is that person trying to do? And are we actually providing them with that once they land on the site?
What about content format? Like you opened by talking a lot about like a blog content, right? And that's naturally where a lot of people turns. But in your view and experience, specifically, I know it's around telehealth, but are there clear winners in terms of format, content formats that are making a difference right now?
Yeah, I mean, there's two parts of that. There's different types of pages, and then there's how you actually structure the pages. So for the types of pages, yeah, I mean, the blog is still a good approach for ranking for informational terms. What you need to be careful about there is what we were saying before about AI search. So is it going to be something that ranks well and actually generates traffic, or is it just something that is going to rank well and that's nice, but it's not actually going to bring anybody through to the site?
Mm-hmm.
So, which is all just to say, blogs still perform well. The underutilized page formats are the other sections on the site, which would be your main navigation and landing pages. Some of those more programmatic style pages as well.
Mm-hmm.
And then also what we would encourage, which might sound a little bit counterintuitive, is shorter form content as well. So in the past, what we've done, which has had a lot of success for telehealth brands, is like an FAQ section on their site. And that's a non-branded FAQ. It's not about, do you take this insurance? It's about, what is this medication, or whatever the question might be. And when we were starting to roll that strategy out like 5-6 years ago, it was really successful. And it was, for some of our clients, like the top traffic driving section on their site was that FAQ where it was essentially the blog, but like we're talking 150 words rather than 1,500 words. And it was great for driving traffic. The issue is that traffic is also now more exposed to AI search. All in all, what we like the thesis of it, I guess, would be we want to diversify, and it's all part of having an ecosystem. Like, I don't want anybody to hear me saying blogs aren't useful, or even these FAQs aren't useful, or just put your focus on the landing pages. It's just about making sure that you are showing up at every point in your prospective patient's journey. And even if your blog or your informational content isn't generating meaningful conversions on its own, it's still supporting the rest of your site and it's proving your expertise, which is pretty essential. And now for the second part of your question, which was, or I guess the second way to take that question, which is about what makes a page work. Pretty across the board, the winners in our analysis wrote good content, and like the copy was solid, written by a professional and expert.
Mm-hmm.
And then it was also, like I said before, just formatted really nicely. So the UX was nice. And what that means is when you have a blog, have strong internal linking, make it easy for someone to find the next topic or next subject that they're likely to be interested in based on what they search to land there. Show the face of the person who wrote it, let them read more about the person who wrote it, include a disclaimer or editorial policy stating, who you are and what you do and your process to make sure that this content is trustworthy and factual. Table of contents are great. I love a floating table of contents that follows you down the page, because if you're writing a great piece of content, it's likely to be pretty long. So just making it easy for people to find what they're actually looking for and all that, I think, is really helpful. And then graphics as well. We're seeing, especially over the last year, when you're able to incorporate visual elements, whether that's an infographic or even just a graphic stylized version of a pull quote from the article itself, like that stuff does definitely help with performance.
Okay, so I'm hearing graphics, I'm hearing Q&A, which I love, frankly, because I'm less likely to read the War and Peace version that's on your blog usually. Yeah. But so I love that as well. So those are some of the key format things that we need to be paying attention to. And you said having someone's letters behind the names, right? I mean, this is about authority, right? And it's a little bit about showing up with authority for your brand. Is there a big difference some brands are startup brands, right? And they're kind of like writing with the assistance of some AI, right? I mean, is that showing up as not an effective way to do something, even though it might be factually,
Yeah,
valid?
gosh. One thing that I've been talking to, so short version to the answer to your question
Yeah.
is, on the whole, no. Like the AI first content, which you just
Yeah.
polish up a bit, then send out, is not likely to perform as well as something written by an expert. And that's much more about the quality of the piece than it is about the letters after the name help. And like having someone with clout write, or at least be
Right.
bylines, that's helpful. That's great. When something's generated by AI, unless you get really good with your prompts and train it on your own database, like by definition, it's writing essentially the average, the median of all the content it can find on the internet about that very subject. And so it's harder to stand out. So the what I was getting at before with my oof was it's a big question, because one thing I've been talking about with people in the space is, in my opinion, it's kind of underestimated how much the purpose of a website is really changing right now. Because a year or two ago, the purpose of a website, or even a few years ago, I guess I should say, the purpose of a website is, yes, you can convert, but it's also largely an information source. If you wanted an answer to your question, you needed, maybe it's just Wikipedia, but you go to Wikipedia or you go to a blog, or you're actually reading on a website. And that is less and less the purpose of a website. And in a few years, it's probably going to be quite a diminished part of what a website is all about. So now what a website is all about, and increasingly more so, is helping somebody make a decision. And obviously for a brand's website, the decision you want them to make is to go with you if they're a right fit for you. All of which is to say that when you're creating content, the question, another question to ask is, why would somebody actually click on this and spend their time reading this instead of just searching on ChatGPT and reading the summary there? And that might be because you have better experts and you can produce actually better, more factual. Like if you go and type that same prompt into ChatGPT, if you think you can actually beat that, write it. And then so that's like expertise. And then the other way that you might approach that challenge is thought leadership, is actually having an opinion, like saying something unique about a subject. You have a point of view that isn't the point of view that they're going to be able to get from an LLM, and it's backed up by people who are, worthy of having a point of view that's trusted.
Yeah, interesting.
So thought leadership or
expertise. Yeah.
Okay. Those two, I feel like those two are very similar. But in your mind, they're distinct. Like you kind of.
Yeah. For expertise, really what I mean there is the quality of the content itself, like being able to go above and beyond in terms of, and it's getting harder.
Yeah.
And thought leadership is the perspective. Like actually saying something that someone might be interested in.
Yeah. Okay.
I have a point of view too, that, and maybe this is right or maybe this is not right, but if you're getting an AI is almost biased toward businesses that are online businesses.
Yeah.
So if you're an in-person business, right, there's just less content about you.
Yeah.
And so, a go-to-market strategy that comes up on AI is very biased toward a SaaS business, right?
Yeah.
I don't know, that's what I see, at least.
Yeah.
Some of my research.
Yeah, because they're likely to have more content online.
Yeah.
It just makes more sense if you're a national brand.
Right.
To write a lot
Right.
of content.
All right. So that's fascinating. Let's switch over to your other piece, which is the AI search in digital health guide. Now, that piece is a little bit different because you kind of went deep on that one, really, versus breadth, which I think is kind of interesting. So, and you looked at LLM driven traffic, which everybody's like, trying to crack the code on that. And then LLM driven conversions, which I think there's a story here. What does good look like in that space right now? And then I'm going to come back to you because remember a few months ago when we talked, you were very bullish on Gemini or Google. So I'm like wondering, is that where you still live? And how are you thinking about that now?
Yeah, I'll tease by saying no egg on my face yet.
Yeah, exactly.
There you go.
Google just did you a solid there.
Yeah, yeah. They're backing me up. Thanks, Google. Yeah, so to start, what we found, we looked at, I think it was about a dozen digital health sites. And what we found is that on average, traffic coming from LLMs, which is ChatGPT, Perplexity, Claude, not importantly, not Google or like not the AI overviews in Google. That represents less than 1% of the traffic that these sites are getting. I think it was 0.8%. If you look at their total organic traffic pool, 0.8% of it is from non-Google LLM traffic. With that being said, the growth trend was pretty exponential. So it's rising quickly, but it's still a very, very small amount. Importantly, the metrics when we talk about AI search are a little bit different. Like nobody expects to get the same amount of traffic from AI search just because of the nature of it. For the same reason we were talking about before. It's satisfying intent right there on the summary. But what we do hope to see is that, as traditional Google traffic goes down, as LLM traffic goes up, what we would hope to see or expect to see is that conversions at least stay the same. And the reason for that is for the businesses we're talking about, at least, somebody still needs to go through to a website to convert. For a telehealth business, they need to go and fill out the enrollment form, for example. Yeah. I make that caveat because if you're looking for a restaurant, you don't need to necessarily go to a website. You can read the summary. You can say, "No, Gemini, I actually want you to find a more romantic place," and then it'll do that. And then you can just call the number they give you, and you never need to go to a website. But for sites for brands where you do need to go through to the site, conversions should stay flat at the very least. So good right now would be, on a percentage basis, around 1%, if not a bit higher, of your traffic coming from LLMs relative to organic search. It's definitely still overblown, the impact that AI search is having on SEO at the moment, but we do expect that to continue to change. To your question, my money's still on Gemini for what that impact looks like. So it's still largely going to be Google traffic, so to speak, just looking a little bit different. And then from a conversion perspective, that was really interesting. So like I was saying, we expect traffic to go down, or at least traditional traffic to go down. But if people need to convert, they still need to convert on a site. So conversion should stay at least flat. And that's exactly what we saw in the data. So that kind of confirmed an expectation we had there. So organic traffic from Google to the sites we looked at was actually down 40% year over year. But the conversion rate of the traffic they were receiving jumped enough that the conversions were essentially flat for that data set of clients over the same period, of sites for the same period. So that would just confirm that the conversion rates are increasing because the less qualified traffic is not ending up on websites, essentially.
It goes back to, I think, the point you made earlier, which is websites are shifting from more top of funnel informational and awareness towards middle of funnel conversion. You're coming to the website because you want to take the next step.
Exactly.
That's a good perspective. That's a good insight. I've not heard anyone position it that way yet, but that's a very clear way to say it. I like that.
Another way my boss likes to say it, Dale, who from Fire and Spark, he often talks about how AI tools or LLMs are pre-qualifying your traffic for you.
Right. Yep. Yeah. Yep. And so, but when they come to the website, they're already knowing, okay, this is a company
follow.
Right. Yeah.
Okay. So the ratio of LLMs for conversion should be higher, right?
What do you mean by that?
I mean, from traditional, like if we had so much search traffic, right, that was really information based in the past, right? I mean, even though I think of search as a little bit further down funnel, right? But are we seeing that LLMs have a higher conversion rate because it is pre-qualified?
Yes, we are. So another finding is that LLM conversion rate was 50% higher than the conversion rate of traffic coming from traditional Google search.
Oh, wow.
So and conversion rate data is always messy and noisy, but the apples to apples comparison is helpful. So when we looked at traditional Google traffic, it was converting at a 2.8% rate across these sites. Looking at the same actions in GA4, the LLM traffic was converting at a 4.3% rate. So if your site's converting at a 4.3% rate, that's fantastic. Like you should go pop some champagne. That's really exciting. One thing we note in there is I would expect it to go down over time. Like I wouldn't necessarily expect it to stay so high. And the primary reason I say that, which is largely an assumption, is just I think more people who are using AI search, like opening up a Perplexity window, are likely to be people like us, a little bit techier, a little bit nerdier. And at least I know when I decide to go and do that, I'm like actually trying to make a particular decision. I'm not just like using it like my mom might pick up her phone and use Siri or something like that.
Okay, so no, then the next logical question, right? Assuming, let's take your premise, right, which seems solid. So the next question as a marketer then is, okay, so then how do I optimize search results in LLM, right? And is the approach there, like, can we still rely on traditional SEO tactics, or is it different with LLMs?
The Venn diagrams overlap a lot. So one thing we feel very passionately about, or I feel very passionately about at least, is that there's no real reason that you should need to hire, say, an SEO person and an AEO person.
Yeah.
Like it's
Right.
essentially the same job. When we look at the work that we do for our clients, it's about expanding, especially on the monitoring side, expanding the scope of what we're monitoring and looking at and the inputs that we're taking in.
Mhm.
If you're writing a piece of content, I mean, yes, there are some things that are, technically slightly better for AI bots to find to crawl and understand your site that help with that process.
Mhm.
But it's really not all that much different from what we were doing before. Where I think it differs is monitoring. So you can see how you're showing up in AI results, meaning are you showing up? If not, what is getting cited that is helping dictate what's showing up? So is Claude or ChatGPT pulling from a particular roundup article of the top five blanks and brands in your space? And if you're not there, you should probably be there and things like that. And then also from a strategy level, which again goes back to what we were talking about before. If you have all your eggs in the informational content basket because you've been searching and chasing search traffic for the last however many years, like that needs to change. Like it's no longer okay to be undiversified with your essentially your keyword profile to get about it.
So what I'm hearing you say is diversification is key, right? SEO, traditional SEO is great. Of course, you need to show up in LLMs because they convert at a higher rate. So why not, right? Although you do have to watch for when you need to convert somebody on the site for something, which I think is an interesting distinction, right? For an enrollment, say, I used to do hearing tests, right? So you wanted to have somebody come in for a hearing test. That was like right before you would buy, an indicator of intent. So what I'm hearing is diversification is key. And then what mistakes are some people making then? Just going all in, or like you just said, somebody, thinking they need an AE or an
Yeah. Hiring the AEO agency.
agency versus a SEO. Is that some of the
Yeah,
mistakes?
that's kind of paying twice for the same thing is my view on it. I think that the biggest mistake, to kind of boil it down, is not often enough asking the question, should we pursue this? In SEO would be a keyword. Should we pursue this keyword?
Mm,
It's too often asking the question, how do we? So like, how do we show up when somebody searches or enters this prompt into ChatGPT? And I think that SEO going forward, or AEO, or whatever we call it, is going to have to involve more critical thinking about, is the juice worth the squeeze for trying to show up for a particular keyword or prompt? So if you're looking at Google, if it's maybe it's a competitive term and there's also an AI overview, the term might mean that Google is showing. I was just looking at one the other day in the real estate investing space of a different company. There were like 4 or 5 ads. So pretty much everything above the fold is an ad. And then there's an AI overview. And then there's this box with frequently asked questions. And then there's organic listings, all of which were for major financial institutions. Yes, the term itself, I would love to show up for that term, but how much is it going to actually cost me to get there in terms of time and resources? The AI overview alone might be enough for you to make that decision. Like if that is satisfying the intent, whatever that little summary says, or how much value are we really going to get out of having a writer dedicate time to writing a piece of content on that subject? And then on the LLM side, yes, we want to show up in AI search, but it's just not going to be worthwhile for each and every one that's relevant. And I think too often people are looking for terms or prompts that are quote unquote relevant, meaning they talk about the subject matter for which you provide a service. But that doesn't necessarily mean that, forget conversions. It doesn't necessarily mean people are even going to see you or notice you if you are able to get cited in certain prompts. Or if they are, it might not be the right person. It might not be someone who might ever become. It might be very often in the medical space that would look like a query that's quite academic, and you can tell someone's searching it because they're cramming for their medical exam or whatever it might be, rather than someone who might become a patient.
I'm sitting here thinking also, sometimes, right? And this is the chase for traffic versus the chase for conversion a little bit,
Mhm.
right? Which is, we used to, kind of chase some of these keywords that were like industry informative words, right? But if you have a long sales cycle, it takes forever to get you in the buyer's seat. So that's another one that the cost of the traffic may be really high, right? To get you into that informational, and then by the time it's conversion time, I don't even know how you measure that. How do you even measure conversion that's over a year?
Honestly, you don't really. It can be really difficult. Another thing that brings to mind is we are encouraging our clients to do more surveys of their customers or their patients whenever possible. So when they're filling out an onboarding form or a request for a callback or things like that, just include the question, "Where did you find us?" More, include some of the more popular LLMs maybe. And if you're feeling really spicy, you can add in a question asking them what they searched to find you. Because that data is getting more obfuscated. It's getting harder to find that.
Do you get, how many responses do you get when you include that?
Very few. I mean, it depends on the way that you're able to do it. We have some clients who have hired a firm to do some customer research for them.
Yeah.
And thankfully they come to us and say, "What would you want to know?" And we slip it in there, and that's pretty effective.
Okay.
Usually on a form, if it's a short form already and you just add a "how did you find us?"
Yeah.
People will pick Google or they'll pick whatever it was. If it's an optional, it's not going to be a very high response rate, but it would still be.
Yeah. I love the question though. If you can get the answer to the question, that's like direct data right there.
Super.
The thing you said too about should you go after that?
Mhm.
The way you answered it, it made me think of in as traditional SEO, it's the difficulty of ranking, right? It's like I think that's the point. Is that the point that you're making? Which is like, hey,
Well, it's difficulty of ranking. So, like in that example for that financial institute company, there's the ads. So that's not going to show up in the keyword difficulty scores, how many ads there are. Usually they're going to be pretty correlated. Because if it's difficult to rank, it's probably because there's a lot of money to be made there. So people will be throwing money at it. And then there's the difficulty piece, which is at the bottom of that page I was describing, where you're going up against Fidelity and Vanguard and government institutions. And then there's the middle piece, which is the search features, the AI overview. So that's really what I was trying to highlight as being kind of new here, is fewer people needing to click through to forget if it's Fidelity or the mom and pop brand that you run.
I think I'm still trying to make sure I got the point clear. I think what you're saying that when you look at the types of search results that getting from that, consider whether or not the AI overview is already providing enough information. So you're fighting an uphill battle if you're trying to win something against that. Is that kind of what you're saying?
So,
yeah.
Okay. So there's a matter of difficulty. What's the chance we actually can show up here?
Yeah.
And then there's the value that you're likely to get. And the value shows up in two ways. So let's say you were able to write a great piece of content and show up first. One way or probably more than two ways, but one way you can measure the value is, are those people who click on your site ever going to convert? So that's like the conversion potential of that traffic.
Yeah.
And then the second thing, which is a bit newer, or at least looks newer now, is click-through rates, where we're seeing AI overview show up. And even if you're showing up right below the AI overview, the number of people clicking through to any site is significantly lower for certain terms.
Okay.
I think I actually saw some very devastating data on this one. Wasn't it like 41% lower search rate in some of the healthcare?
Yeah, 40% lower traffic.
What?
Yeah.
That's enough to scare somebody. For
Say
sure.
that one again. 40% less traffic to what?
Traffic
to health?
to websites, to the websites we looked at.
In general, or you mean from certain sources?
Healthcare.
From organic search. So that's exactly the main finding, I would say, is traffic is going down largely because of LLMs and because of AI overview. So click-through rates dropping.
I see.
But the reason, and the way we phrased it in the piece is like, if you're a healthcare publisher, if you're WebMD, like, you have reason to be scared because you make money off of, I don't know how to referral, like referring to products and ads.
Yeah.
If you are actually providing a service, we are not seeing reason to be worried about that because converting traffic isn't really going anywhere.
Yeah. Okay.
At least, they haven't figured it out yet, ChatGPT and all of them.
I got what you're saying. You're making the correlation back to a lot of website traffic traditionally has come from people looking for answers. And so then they come to your website to consume
Yeah.
content.
Traffic
Yeah,
versus
yeah,
conversion always,
yeah.
right?
Goes back to the original point. Yeah,
You have to frame that the right way
yeah.
as a CMO, right? I mean, you have to really be helping clients understand that, or your own company, et cetera.
Yeah.
I wonder if that same statistic shows up in other industries. I know you're focused on health,
Yeah.
so that'd be curious. Yeah.
I would expect it's something similar. It's going to be industry to industry. Healthcare, every industry has its informational searches. There's
Yeah.
a lot, obviously, in healthcare.
Yeah.
I think it also has to do with, the things that Noah was mentioning, right? What is the trigger to buying? What does that look like for your industry? What's the sales cycle look like for your industry? Those are probably playing a role in that as well.
Yeah.
If you were advising growth stage companies, and this is me right in the smack dab of this one, and digital health and SaaS kinds of companies like it is, what are the top 3 to 5 AI or SEO, AEO experiments that you think that they should run this quarter?
Yeah, I love the question. One of the things I feel very passionate about in my opinion is an estimated or underappreciated aspect of AI search, which is the increased user benefit of branded search in particular. And what I mean by that is it's now easier than ever to understand or to get information on brand A versus brand B, or how brand A works, or what people are saying about brand A. So one of my favorite things to do is have clients or search on behalf of our clients across these tools is brand legit, or brand A versus the competitor that they told us about, or several competitors that they told us about. And very often, if not almost always, what you'll find there is some good stuff and some not so good stuff showing up there. And sometimes we hear the pushback, well, it's not true. And our response is, well, it doesn't matter if it's true. It's showing up and it's turning people away from your brand. Before, I'll speak for myself, when I had to pick between products, for example, I would go on Reddit and I would search using the terrible Reddit search function and try to find threads about the brands that I was looking for, or I might go on their website and remember how much did this one cost versus that. And now all of that's automated. And I think it's just a fantastic use case. And I think it's the kind of use case that is going to be gaining more and more traction. So both from the perspective of you actually want the right information to show up there because more people are going to be using LLMs in that way, it's valuable. And then forget if they're searching that specific term, that's just giving you essentially a free brand sentiment analysis, right? For what is out there on the web about your brand. And if you're not even aiming to address it there, addressing it across forums that might have negative reviews, or developing a good review strategy if you have bad reviews on Google or Trustpilot or whatever else, just very valuable. So I would absolutely suggest a 90-day kind of sprint looking at that branded search on AI and seeing how you can move the needle. And that might be engaging with communities like Reddit. It might be updating content on your website so there's more accurate stuff out there. Or it might be something like a review strategy or even a PR push. On the note of PR, the second thing I would recommend is looking at the prompts that your audience is likely to search. Might be some of those same branded prompts, might be different ones. And see if there's a particular roundup article or listicle that is cited frequently. If there's a particular article or piece of content out there that's not hosted on your website that is frequently getting cited by these tools, that's probably a good place to do a PR push and see if you can get included as well. So that's where SEO kind of overlaps with PR. And then the last thing I would recommend, and this is almost going back to our earlier conversation about that Telehealth 20, is I think there's so much untapped potential in the healthcare space, but pretty much in every company, for kind of the synergy between the operations side of the business, or the delivery side of the business, and the marketing side of the business. So when it comes to SEO content, what that would mean is, if you have let's say in a telehealth space, you might have materials that you send out to payers, so insurance companies or employers, talking about all the benefits of your brand. And you would be shocked how often that information doesn't end up on the website. You're likely to get frequently asked questions during the enrollment process or while providing treatment. Those are the perfect questions to try to answer on your website as well. And sometimes they'll be backed up by search volume and sometimes not. And honestly, in both cases, it's still quite valuable if you can address those questions before they even,
I mean, Noah, this is exactly what I've been saying. It's like sort of put more information that normally sits in the sales call on your website, right? And you might benefit better because those are the questions that everybody's asking before purchase, right?
Yep. And it's all, in our experience, it's all about the process because people get busy. It's like, if you're a salesperson, it's not top priority on your list to recommend topics for the marketing team. So it's all about, making it dead easy, a Google form that people need to submit once a week or whatever works for your organization. But like figuring that out on a recurring basis, the sites we work with who produce the most content and some of the best performing content have that down to a science.
Would it be accurate to say, okay, this is sort of like old schooly, right? So old school, we used to say, never educate somebody on your competitive brand. But what I'm hearing you say is it may be wise to have some competitive information on why your brand excels in the marketplace versus others on your site based on LLM search.
Yeah, I mean, it's something we've been pushing and working with some of our SaaS clients on since long before LLMs came on the scene. It is something that a lot of brands are quite averse to because they don't want to mention their competitors.
Right.
They want to risk getting in trouble and legal trouble. So you got to be really careful. But from an SEO perspective, for sure, it's a big opportunity because people are searching those terms and you would love if they landed on your page. And if not that, short of that, land on a LLM results page that is built off the information that you've provided. Our workaround, if a company is not keen on doing their brand versus their competitor brand,
right? That's a little overt. A lot of people.
Yeah, it can be overt, but company to company, some are into it. Is to just do company like your company versus like different types of competitors. So it could be, for example, if you're a telehealth mental health provider, it could be your brand versus in-person providers or like shock therapy or like alternatives that people might look into kind of as a category.
So last question here. It's been a great conversation. For our marketers who are looking to diagnose where they are today, what advice would you give them? How would you look at your situation and where do you look? What do you look for?
Yeah. So when I start talking to a new brand, the first thing that we ask for is access to their Google Search Console account and analytics if they use that. But honestly, to start, Search Console is usually more helpful. And a few ways I would look at the data, like as soon as I get in there. One, go to the maximum time frame, which is going to give you 16 months and see what the trend looks like. Are you going up or are you going down? Okay. If you're going, regardless, this is the right next step. But especially if you're going down, going to a period over period view, which might be if you're a very seasonal business, last 3 months, year over year, is the default they have. And really looking at the particular keywords that you're losing for. At first, I would just see overall, what are you losing for? And then I would filter out your branded search. So just put your brand name in the stuff you don't want to see and see what else is there. And the reason I'm walking through these kind of step by step process is what I would be looking for is importantly, what you're losing, and are you losing traffic that was this traffic we've been talking about for much of this call that isn't likely to be all that valuable in the first place? If you are you losing that traffic because you're losing rankings? And I think people assume I'm losing traffic, I must be losing rankings. But because there's AI overviews now, you can maintain your same fantastic ranking and still be losing traffic because click-through rates are lower. So I'd be assessing that. Are we losing? What are we losing for? Do we care about that? And if we do care about it, put together a plan of attack for re-optimizing those pages or for those terms. And then similarly, what's winning and how do we double down on that? Whether we can reinvest in those pages or pursue, take the signals from Google, what Google thinks are relevant for, double down on all of that. And then, go ahead.
So selfishly, let me flip that on you. Selfishly, what if you're new into an entrant? What if you're, a new company coming in? How do you punch above your weight class in that space?
Yeah, so that's a great question. It's really all about right-sizing your ambition. And what I mean by that is really, and this is in my opinion, true to SEO, but it's true to marketing on the whole. When you're starting out, when you don't have that foothold, it is all about figuring out what your foothold will be. And that needs to be where you are uniquely well suited to compete. So there's an opportunity, there's a specific hole in the market. Even if you think you're in a specific niche, find your niche within that niche and start trying to compete there. So that is who you provide your best services to, who you are the best fit for, and then speaking directly to their needs as much as possible. And on the SEO side, that is like hyper targeting that keyword space. So if it's, again, mental health, maybe it's depression, maybe what you really do great is depression treatment for, postpartum depression or new moms, and just writing a bunch of content and high quality content and speaking to that audience in particular. And then over time that, you establish your authority and you can expand from there. And I think the mistake that we often see for new brands is a lot of ambition, which is great, but not being willing to make those decisions and focus and invest and really get that foothold, which is going to take a little.
Cool.
That was some very, very practical advice and tips. Thank you for that. That's great. Noah, so if people want to get in touch with you or Fire and Spark, how should they find you?
Yeah, Noah at fireandspark.com. I'm always happy to chat SEO. You can find me on LinkedIn as well. Search Noah Goldfarb. I'm the one with the dog in my picture. Or you can go to our website, fireandspark.com, and reach out, and we would absolutely love to chat.
All right.
Cool. Nice work on these new studies. Excellent information, Noah.
Thank you very much. And thanks for having me, and happy holidays.
Same to you. Thanks for joining us.